Now let's talk about patients' rights. Patients' rights include your rights when you go see the doctor. You can ask for a copy of the rights and privacy policies of your doctor or hospital. Individuals, including yourself, are entitled to see or get a copy of medical records that your practice keeps. Patients may not be allowed to see certain parts of the full record, but they have the right to ask. With the rising cost of health care, we are seeing an increase in people paying for their own medical services. You are not required to disclose PHI with a patient's health plan for payment if he or she is paying for the services. A covered entity must provide an accounting of all PHI disclosures made for treatment, payment, and healthcare operations during the prior 6 years upon request. This includes financial records as they are tied to the health care services. Covered entities are required to provide individuals a privacy practice policy if requested at all times. This notice describes how medical information about you may be used and disclosed and how you can get access to this information. It also describes a process for patients to use in filing complaints, what types of uses and disclosures of PHI are permitted, and what types of uses and disclosures require authorization. Now let's talk about patient authorization. Patient authorization is necessary to obtain an individual's personal health information and billing, but it is not required to treat the patient. We often get asked, can I see a patient without written authorization? Yes, you can, but it is a good idea to update their medical record and note that. However, if you refer a patient to another provider, you must have written authorization from the patient to share that information. In the event of a workers' compensation claim or OSHA, you can provide the patient information. You can alert law enforcement officials of imminent danger to self or others without a written authorization. Think of this as protecting a minor. You know what abuse looks like. If you suspect it, you are authorized to report it. It just may save a child's or adult's life. In another example, the HIPAA privacy rule allows covered healthcare providers to disclose PHI about students to school nurses, physicians, or other healthcare providers for treatment purposes without the authorization of the student or student's parents. For example, a student's primary care physician may discuss the student's medication and other healthcare needs with a school nurse who will administer the student's medication and provide care to the student while the student is at school.